Good morning, everyone. It's a great pleasure to be here. What I want to try to convince you over the few minutes available to me is that microbes within the gut do play a significant role in relation to brain development and function. And I'm going to illustrate that by a number of studies conducted in my department over the past few years. It may come as a surprise to some of you that within the adult intestine, we have about 1 kilo to 1.5 kilos of bacteria, which is essentially the weight of the adult human brain. Many of these microbes are still unculturable, but obviously with modern sequencing technologies, we're able to detect their presence. I find, at least from an evolutionary perspective, it's fascinating that many microbes within the gut are able to produce some of the more important neurotransmitters in the human brain. Now, I'm not for 1 second suggesting that these microbes produce neurotransmitters that actually go to the brain, but I think it is interesting that they're actually capable of producing neurotransmitters. We've done a lot of work with lactobacilli, and all lactobacilli produce GABA in varying concentrations. Microbes can produce dopamine, noradrenaline, even serotonin. So many of the key neurotransmitters within the human brain can be produced by bacteria. Now, how do microbes within the gut communicate with the brain? Well, the vagus nerve is obviously a very important bidirectional route of communication between the gut and the brain. So it certainly is exceedingly important. But there are other routes of communication as well. Metabolic activity of the microbes within the gut produce short-chain fatty acids like butyrate, propionate, acetate, and these get into the bloodstream and have diverse effects in organs throughout the body. Tryptophan is produced by microbes within the gut, and as we all know, that's the main precursor of serotonin, and clearly man has very limited capacity to store tryptophan in the human brain, so we need a constant dietary supply of tryptophan. Of course, another important route of communication is the fact that cytokines produced at the level of the gut can enter the bloodstream and also impact on the brain and indeed other organs. Now, some of the techniques we use in my lab to look at how gut microbes might influence brain development and function would include infective studies where we put pathogens into the gut and look at the impact on the brain. We use probiotic bacteria and look at their impact on the brain. Fecal microbiota transplantation is one of the hottest areas in medicine at the moment, and we've certainly, worked within that area. We've done a number of antibiotic studies, and of course, germ-free is an important technique as well. And we actually have probably the only germ-free facility in the UK or Ireland in an academic institution. So we do quite a few germ-free studies as well, where we actually breed the animals in a germ-free environment and look at the impact on their brain development and function. Now, germ-free is a very hot area in medicine at the moment, and it is very easy to get into high-impacting journals using germ-free facilities. Personally, I'm not a fan of germ-free at all. I use it sometimes in order to get a paper into a higher impact journal, but I think these are very screwed up animals with screwed up brains and screwed up immune systems. They're behaviorally abnormal. They're neurochemically abnormal, as I'll show you in just a moment. So I'm not sure that we learn very much from them at all. When we look at BDNF levels in these animals, the BDNF levels in the hippocampus are certainly altered. Their stress responses are abnormal. If you look at germ-free animals as compared to ordinary animals, when you stress an ordinary animal, the corticosterone goes up like this. When you stress a germ-free animal, you get much higher responses. So their stress responses are abnormal. Likewise, their patterns of behavior are very abnormal. One of the ways in which we look at social behavior in the lab is to use the 3-chamber test. Now, in this test, we put the germ-free animal in the middle chamber, We might put another animal in the first chamber and maybe an object in the third chamber. Now, a normal animal will spend more time with another animal than it will with an object. But germ-free animals don't behave like that. They're as likely to spend time with the object as with the other animal. So they have very autistic patterns of behavior. We published that in Molecular Psychiatry a year or two back. So really, I'm not sure that germ-free animals tell us very much because they are very abnormal creatures, but they do tell us that we need bacteria in our intestines for our brains to develop normally. So from that point of view, I think they are relevant. Now, the model of depression that I've used in my lab for many years now is the maternal separation model, where we, between days 2 and day 12 postnatally, we remove the pups from the mothers for 3 hours a day. We put them into a warm cage, and at the end of the 3 hours, they go back in with their mums again. So it's just between postnatal day 2 and postnatal day 12. When these animals grow to maturity, the majority of them are highly anxious animals. Their exploratory behavior is altered. Their corticosterone levels, as you can see here, are much higher because they're a much more stressed group of animals. And they also have a pro-inflammatory phenotype with far higher levels of pro-inflammatory cytokines in the plasma. And as we showed in this paper in Biological Psychiatry a few years ago, the microbiota is narrowed in these animals. So early life adversity, which in this case is maternal separation between postnatal day 2 and postnatal day 12, results in a narrowing of the microbiota. Now, one of the most interesting findings, I think, in recent years in microbiota research, and it comes actually from my colleagues in Cork and the ElderMet group, a paper in Nature two or 3 years ago, was that healthy aging is associated with diversity in the microbiota. If we want to age healthily and we don't want to age in a frail manner, it is absolutely essential to maintain diversity in the microbiota. Narrowing in the microbiota as we age is associated with frailty. But we're not talking about aging animals here, but early life stress is clearly narrowing the microbiota. Now, I decided to take a group of major depressives who were attending my clinic and to profile their microbiota and compare them with age and sex-matched healthy controls. And here's a PCA plot of the microbes in the depressives and the healthy subjects. And as you can see, there are quite radical differences. Bacteria like Prevotella are significantly reduced in depressives, pre-Prevotella. There are many differences between healthy subjects and depressives. Now, we've looked at diet, and that certainly doesn't explain the differences. We've looked at things like exercise. We've looked at a variety of factors. But certainly, what I think we conclude is that for whatever reason, people who are depressed have a somewhat different gut microbiota to people who are healthy and not suffering from depression. So I then decided to do a microbiota transplant into rodents, into rats, and to do the transplant either from depressed patients or from healthy subjects. So we were going to here now essentially humanize the microbiota. I could have done this in germ-free, but you know my attitude to germ-free at this stage. So I decided to take healthy rats and to give them a humanized microbiota. I knocked out their microbiota with this cocktail of antibiotics here, and then we did a transplant with either the microbiota of a depressed subject or the microbiota of a healthy subject. Now, this hasn't been published yet. So what we essentially find is that there are major behavioral changes in the animals who receive the transplant from the depressives. They are anhedonic. We demonstrate that by sucrose preference. Rats prefer sucrose in water than plain water. These animals don't. So they're anhedonic. They are far more anxious than usual. On the forced swim test, which is the test used in the pharmaceutical industry to detect antidepressants, they show a depressive phenotype. When we look at their tryptophan metabolism, it clearly, as you can see here, is altered. We also find a number of other changes. CRP, which we and others have reported as being elevated in major depression, it goes up when these animals receive a transplant from a depressed subject. So, and this doesn't happen when they receive a transplant from normal, healthy individuals. So, giving a transplant from a depressed patient to a rodent results in a transfer of a behavioral phenotype. Now, I think this is very relevant, perhaps, with the large number of fecal microbiota transplants that are largely being conducted to treat intractable C. difficile, but you're seeing it now being rolled out perhaps for treating Parkinson's disease and other conditions as well. And I suppose what my study would tend to suggest is we need to be careful in profiling the donors, because we may be transferring a psychiatric phenotype with the microbiota transplantation. Up to now, the main focus has been make sure there are no viruses or no pathogens in the microbiota. But this study might suggest that we could, in fact, transplant a psychiatric or a behavioral phenotype. This is just showing you the sucrose preference and the altered behavior in the open field, which is indicative of high levels of anxiety, and the elevated plus maze, where they're clearly far more anxious as well, the animals who received the transplant. Now, a few years ago, I introduced in this paper in Biological Psychiatry the concept of a psychobiotic, which seems to have taken off in the literature. And I defined a psychobiotic as a bacteria which, when ingested in adequate amounts, had a positive impact on mental health. Now, it seems to have been taken up, in the psychiatric literature, but the New York Times have ran a few articles on it. John Cryan and I have a book coming out in National Geographic on the topic. We signed the contract before Murdoch and Fox took over National Geographic, but anyway, they paid us up front, so I'm not going to complain. So is there any possibility that bacteria, which I suppose traditionally might have been referred to as probiotic, can actually impact on behavior? I want to demonstrate now or suggest to you that that is probably the case. Here is a study we published a few years ago, one of my PhD students, using a bacteria Bifidobacterium. And what we showed in this particular study is that Bifidobacterium, which is a bacteria we isolated in Cork from a baby's nappy, increases tryptophan levels in the plasma quite dramatically, and also has the capacity to reduce corticosterone levels quite dramatically as well. So it did seem to have an endocrine and an impact on tryptophan also. And in the this is the effect of this particular bacteria, the Bifidobacterium, in the forced swim test. Now, as I mentioned to you, the forced swim test is used largely in the pharmaceutical industry to detect antidepressants. And in this particular study, Bifidobacterium seems to have antidepressant-like behaviors in the forced swim test. This is a study we published in PNAS, and it was a bacteria, a Lactobacillus rhamnosus. Now, we got this Lactobacillus rhamnosus from John Bienenstock's lab in McMaster, and he felt that this particular bacteria was, in fact, anxiolytic when he gave it to animals. So we decided to do a placebo-controlled trial. And we found in the placebo-controlled setting that, yes, indeed, it was potently anxiolytic, that if you looked at animals' exploratory behavior when they were given Lactobacillus rhamnosus as opposed to placebo, that they explored more, that they were less anxious. And as you can see, when they were stressed, the Lactobacillus rhamnosus attenuated the corticosterone response. So they still had a corticosterone response to stress, but it was less significant. So Lactobacillus rhamnosus in this placebo-controlled trial clearly had anxiolytic activity and attenuated the humoral response of stress. So how was it doing this? Well, we looked at the expression of both GABA A and GABA B receptors. The GABA A receptor obviously is a classic ionotropic receptor, whereas the GABA B receptor is a GPCR. And we looked at the expression of GABA A and GABA B. Now, again, this is a placebo-controlled trial where animals are fed either Lactobacillus rhamnosus or an inert broth. And what we found essentially is that lactobacillus rhamnosus had a dramatic impact on GABA expression throughout the brain. If you look here at the cortex, if you look at the infralimbic cortex, the prelimbic cortex, you have a radical reduction. The amygdala, the basolateral amygdala, you see a reduction. The dentate gyrus, there's an increase. So there are alterations in the expressions of both GABA A and GABA B receptors throughout the brain. So the question is, how could a bug be bringing about changes in the expression of both GABA A and GABA B in the brain? So what we did was we took a cohort of animals and we vagotomized them, and we took another group and we sham operated on them. And then we fed them either lactobacillus rhamnosus or an inert broth. So it was all placebo-controlled, basically, and as I say, they had either a full truncal vagotomy or they had sham surgery. And what we essentially found was when the animals had a vagotomy, lactobacillus rhamnosus had no impact whatsoever on anxiety. The animals were as anxious as if they had received nothing. So lactobacillus rhamnosus needed an intact vagus nerve. Likewise, when we look at the distribution of GABA receptors, and you can see the in situ hybridization study here at the end, the GABA changes were dependent on an intact vagus nerve. So if the animals didn't have an intact vagus nerve, you didn't get changes in GABA receptors within the brain, which I think is quite intriguing. As some of you may have seen the recent paper on Parkinson's disease sufferers and the Scandinavian study, where they showed that when individuals back in the 60s and early 70s, before the introduction of H2 antagonists, had a full truncal vagotomy for peptic ulcer disease, that their risk of Parkinson's disease subsequently is radically decreased, suggesting some toxin or other spreading up the vagus nerve in Parkinson's disease. But anyway, whatever about that, what we demonstrated here is that in these animals, the animals needed an intact vagus nerve for lactobacillus rhamnosus to have any impact on behavior. Now, this is another bug we've worked with, biflongum. And this is a translational study, so we started off in rodents and then we move it into man. And in this particular study, we first of all did a marble burying test. Now, the marble burying test is a test of anxiety. When animals are more anxious, they will tend to bury more marbles. And we did a study of a biflongum with a bif brevis. So they're both bifidobacteria, and we compared it with escitalopram and a vehicle. Now, you can see that the biflongum certainly had the greatest impact on anxiety. It actually had more of an impact than the escitalopram did in this particular study, so it reduced anxiety levels. We then tested them on the Barnes maze. Now, the Barnes maze is a maze with, as you can see, a large number of holes, but there is only one escape route. There's only one hole that's the escape route. And the animal has to learn which is the escape route. And it will obviously make a number of mistakes before it learns which is the appropriate escape route. It doesn't obviously want to be exposed on the open here. And what you see is that biflongum seems to have a dramatic impact on the number of errors made by the animal. So the bif seems to have an impact on anxiety levels, and it improves cognitive function in the sense that they learn more rapidly when they're receiving the biflongum. Now, we then did a placebo-controlled crossover design study in healthy male subjects. And they received either a month of placebo or a month of biflongum. So they had a month of each. So it's a crossover design. When they're on the biflongum, they report themselves as feeling less stressed. So now, this is statistically significant. I'm not suggesting it's a major reduction, but at the end of the day, it's placebo-controlled. They are reporting themselves as less stressed. And interestingly enough, now the awakened cortisol response we've been doing for years, we measure cortisol in saliva. When the subject wakes in the morning, we take a number of samples of saliva and we measure the cortisol in the saliva. And it's a very good measure of stress. And as you can see here, when the subjects are on biflongum as opposed to placebo or the initial visit, the awakened cortisol response is decreased. So clearly, from an endocrine perspective, they're less stressed and they report themselves as less stressed. When we look at a number of aspects of cognitive function, we use the CANTAB in my lab quite routinely. And this is, I could show you a number of aspects, but I'll just look here at the data on paired associate learning. I suppose the first thing is there does seem to be a placebo response, but the response to probiotic is clearly more significant than the response to placebo. And we are finding some EEG changes as well, in beta activity in particular, but in other EEG changes also. So this biflongum has a modest but nonetheless definite effect on anxiety and does seem to improve cognitive function. Now, I'm not going to suggest for a second that these are dramatic effects. We're not talking about a drug here, we're talking about a probiotic. But nonetheless, I think the effects are real. They're small, but they're definitely real. Now, as I mentioned a while ago, there has been an increasing interest in recent years on the microbiota in aging, because certainly as people age, there tends to be a narrowing in the microbiota and a diversity of microbes within the gut, and that narrowing is highly correlated with indices of frailty. So in this final study I want to show you, we have a colony of aging mice, and we looked at the aging mice and compared them with ordinary younger mice. And what we were interested in is looking at the impact of stress on the aging process. Now clearly, from a clinical perspective, that is important. I mean, I think that elderly people in our society are often exposed to significant stressors that younger people aren't. Their friends, their relatives die. They may have more financial problems. I mean, we all see this in our clinics on a regular basis. So what I wanted to look at here was, in a very controlled environment, in rodents, what impact would stress have on the biological processes of aging? Now, from a behavioral perspective, the aging animals were different to the younger animals in a whole raft of behavioral tests. I mean, if you look at novel object recognition, which is a cognitive task, they didn't perform as well. If you look at performance in the elevated plus maze, they spend less time in the open arm, so they're more anxious as animals. They spend much less time in the open arm. If you put them into an open field, they'll spend less time in the center of the field because they are more anxious overall. And in terms of their behavior in the three-chamber test, they tend to perform in a way that a younger mouse will tend to spend more time with a novel mouse than it will with a familiar mouse. These older mice didn't behave like that. They were as likely to spend time with the familiar as with the novel. So overall, their behavior patterns were certainly were different, and their cognitive performance not as good. I suppose overall, not too surprising. So what about the intestinal barrier function? Because there's been an increasing suggestion in the literature that in depressive illness and perhaps in aging, that there may be defects in barrier function. Now, what we did was we gave this form of dextrin by gavage, and we looked at younger mice and older mice. And as you can see, the plasma levels of the dextrin in the aged mice were somewhat higher. So they were absorbing more of this dextrin. Which would suggest that there are differences in the barrier integrity in the older mice. But what happens when we actually stress these animals? When we stress these animals, the barrier function deteriorates quite dramatically whereas it doesn't change at all in the younger animals. So the absorption of the dextrin is increasing quite dramatically. Now, what relevance does that have to, let's say, depression? Here now, we're looking at aging animals versus young. And what we see is that there are higher levels of pro-inflammatory cytokines in the aged animals as opposed to the younger animals. And the reasons for this are probably related to the integrity of the barrier function. When the barrier function is defective, and there's overwhelming evidence to suggest that in stress, and even in younger individuals, that barrier function is altered, and that molecules like lipopolysaccharide from gram-negative bacteria can get into the bloodstream in such circumstances and generate a pro-inflammatory phenotype. So when we look at, it's been recognized for almost 20 years that patients with major depressive illness have a pro-inflammatory phenotype, that they have higher levels of IL-6 and IL-8 and IL-1 and TNF-alpha. I mean, there have been numerous groups. Michael May's group showed it many years ago. We've published several papers years back. So there are many different studies in the literature showing that depressed patients have a pro-inflammatory phenotype. I think what the literature is now suggesting is that that pro-inflammatory phenotype is emerging because stress does impact on barrier function in the gut. And in the presence of intense stress, and this is particularly true in the aged, one ends up essentially with a leaky gut. And molecules that are not normally capable of traveling into the bloodstream, like lipopolysaccharide, travel in the presence of intense stress, where the gut, as I say, becomes leaky. So, in summary, ladies and gentlemen, I think the microbiota does play a very significant part in regulating our stress response. I do think that it is possible to utilize that fact in a positive way. And I do think that there are putative probiotics out there that can actually have an impact, at least in milder forms of mental health disorders or problems. I've shown you positive data in relation to 2 or 3 microbes that seem to have a positive mental health benefit. In reality, most of the probiotics out there that are being touted for all sorts of conditions do absolutely nothing. Some of them don't even pass through the gastric acid in the stomach without being killed. So not all probiotics can clearly have psychobiotic potential, but I do think that there are selective microbes out there, and I think that within 4 or 5 years we'll actually see microbes licensed on an RX basis for treating milder forms of anxiety and depression. And I do think that, when it comes to a defective barrier or a leaky gut, that it's probably relevant to depression as a whole, but it definitely is especially relevant in the aging population. Thank you very much for your attention.
Thank you for a fascinating talk. We'll open up to questions.
Fascinating talk. Thank you. It seems like we are what we eat. And I was wondering about different cultures and different people in different countries eat very differently. But there is no evidence that there is a different rate of anxiety or depression. So surely if they eat very differently and have different lifestyles, their gut microbiota should be very different. So how do we explain that?
I would agree entirely that, the microbiota is very much determined by our diet. I mean, there are other factors as well. But I'm not so sure that, in fact, the diet doesn't actually in some way impact on the microbiota, which then impacts on mental health. We had a paper in psychoneuroendocrinology there about 2 or 3 months ago in which we showed that a diet rich in polyunsaturated fatty acids, had a dramatic impact on the microbiota and on stress responses. And we do know that people in Mediterranean climates do have less depression than people in Northern Europe. So I think the point you make is a very important one. Diet and the microbiota and mental health are linked. And I do believe that an adverse diet, a McDonald's diet on a constant basis, does result in a pro-inflammatory phenotype that you do not see in a Mediterranean diet or in many other international diets.
Thank you very much. I'm interested in the timescale of the changes that you might expect, because there are all sorts of situations in human beings where their gut flora are altered profoundly. For example, you go for surgery, you have antibiotics, changes your gut flora profoundly. You have an attack of gastroenteritis, it affects your gut flora profoundly. So what would be the time course that you might expect of the mental changes that would go along with those gut flora changes? Would they be long-lasting, or would they be short-lasting, or would they be non-existent?
Right. I think they can be short-lasting or they can be long-lasting. And I'll give you one example. I think the Walkerton study in Canada is of major importance to psychiatrists. It's one that only the gastroenterologists look at, but Walkerton was a rural town in Canada where the water supply a few years ago was contaminated by E. coli, and everyone in the town developed gastroenteritis. And the gastroenterologists at McMaster have followed up the cohort because they were interested in post-infective irritable bowel syndrome. And of course, some people did develop post-infective irritable bowel syndrome. But what I think is intriguing as a psychiatrist is that at 2 years follow-up, the rate of depression in the community is radically increased. So I do think that you can modulate the microbiota and have very significant long-term consequences. On the other hand, I've worked, and I'm sure other people have as well, with minocycline. Now, minocycline is usually, it does seem to have an impact in depression. It potentiates antidepressants. It is usually interpreted as having an impact on the microglia, which Thomas, of course, mentioned earlier on. But the reality is, it's far more potent against gram-negative and gram-positive bacteria in the intestine than it is against microglia. It is 100 times more potent. So I am convinced that minocycline, when it acts in depression, is acting through the gut and not through the microglia, or not as majorly through the microglia.
Thank you for a fascinating talk. I'm a licensed psychiatrist who works a lot with patients who...
Sorry, is it? Yes, well, yeah, indeed. Most of my work is focused on bacteria, but of course, the viruses, and particularly phage in the intestine, are exceedingly important. I mean, they're not, I have no expertise at all when it comes to viruses. And one of the intriguing things about the human virome is we don't know what it is. I mean, at this stage now, we know what the human bacteria are essentially, or what healthy bacteria in the gut are. But in fact, we have no idea what a normal human virome should be. And of course, viruses in the intestine, particularly phage, do determine the distribution of bacteria within the intestine. So I think what I'm looking at is a very narrow view of microbes, because they're clearly much wider than I'm suggesting. Yes.
Because we are using microbes and microbes in the slide. Just better just use microbes.
Perhaps the microbiota, I suppose, is usually used to refer to bacteria that have been sequenced genomically. They may not have been grown because they may not be culturable. But I agree with you that there's a definitional problem here, you know, and we are dealing with a rather narrow cluster of organisms.
Just a couple of quick questions. Fascinating talk, and just thinking about the subgroups identified by Professor Frodel in his talk, and you know once some of the patients who do have adverse early experiences and carry a risk of depression, have cortisol blunting and so on, and whether you know their psychomotor would be very different. I see a lot of patients in gastroenterology as a liaison psychiatrist, and I'm just curious to think what their kind of chronic symptoms of irritable bowel and so on might do to impact on this. Lastly, working in eating disorders, when patients with anorexia are recovering, they often go through a stage of very difficult abdominal symptoms as they're refeeding and gaining weight, and often a sort of sequelae following that. And I was just curious to know whether that's come across, whether you thought of maybe having a look at that patient group too.
Indeed, yeah. The irritable bowel syndrome is certainly very interesting, and obviously an enormous amount of work has been done on the microbiota and irritable bowel syndrome. I think anorexia nervosa is interesting. I'm certainly no expert on the topic, but what I find intriguing recently is the fact that clearly there are certain microbes that are capable of extracting more calories from the food supply or the diet. And it would seem that, you know, people who are obese, as has been demonstrated in a number of studies, are capable of extracting more calories per unit of food. And what is intriguing is in an anorexia nervosa, the microbiota radically changes, and you end up with a narrow microbiota that's capable of extracting far more calories. So in other words, it's almost as though the microbes are trying to keep the person alive because, you know, if the person dies, obviously the microbes go with them. But the actual microbiota in anorexia is radically altered, and you get a far greater absorption of calories per unit of food than you do than would an average person. Thank you very much.
Actually, yeah, maybe one quick question.
If you can bear a question from a neurologist in relation to your minocycline point. So presumably, if you follow that logically, the proposed effect of minocycline on the neuroinflammatory response to TBI might be through the gut, particularly if the gut is increasing, if there's increased gut permeability after TBI. Is that known, whether there is or not?
No, it isn't known, and you raise a really important point. No, it isn't known. And there is, you know, when you look at the minocycline literature, no one mentions its impact on bacteria. I mean, the whole focus is centrally and on microglia. And yet, I mean, the reality is, biologically, it is clearly far more potent as an antibiotic than it is as a microglial stabilizer. But no, there has been no study, and to my knowledge, you know, looking at the relative contributions there and the possibility that it might be gut rather than direct brain impact.
Thank you so much, Professor Dinnan.